In this video and subsequent videos, I'm going to talk about the pancreas, and actually this is a very important subject. Okay, so I'm going to talk about the pancreas from the surgical point of view, starting with the anatomy of the pancreas, and then I'm going to get into the physiology, the pathophysiology, and then the pathologies of the pancreas from the surgical point of view, as I mentioned. Okay, so the pancreas is to be called the most unforgiving organ in the body, and the question is why. The answer is clear: because the pancreas is surrounded by very vital and important structures around it. Okay, so you can find very important blood vessels like the aorta, the portal vein, the vena cava around the pancreas. Okay, and you can see very important subjects, structures like the duodenum, the stomach, and the liver, and the spleen, and the kidneys. They are all around the pancreas, because the pancreas actually is in the center of the abdomen. Okay, deeply in the center of the abdomen. So it is a deep organ, the pancreas. It's actually retroperitoneal organ, as I will say. Okay, so a minor trauma to the pancreas may lead to a serious release of the pancreatic enzymes I'm going to mention subsequently. Okay, and releasing of these pancreatic enzymes will lead to what we call the pancreatitis. Okay, and this is actually a serious problem. So knowing or studying the surrounding structures of the pancreas is very important for the surgeon to avoid injury during any abdominal surgery to the pancreas that may lead to a life-threatening condition. So the pancreas is actually a retroperitoneal organ. And what do we mean by retroperitoneal organ? That we have what we call the intraperitoneal organs and the retroperitoneal organs. Okay, the intraperitoneal organs are organs that totally surrounded the peritoneum in the abdomen. Okay, and the retroperitoneal organs actually are not surrounded by the peritoneum, so they are just covered anteriorly with the peritoneum, but the rest of the organ is not covered by the peritoneum, just like the pancreas. So it's a retroperitoneal organ, a deep organ of the abdomen. Okay, so actually the pancreas is sloping upward from the C shape of the second part of the duodenum toward the spleen. Okay, so it starts from the concavity of the duodenum and moves upward toward the spleen. In an adult, the pancreas weighs about 75 to 100 grams, okay, and it's about 15 to 20 centimeters. Okay, so the weight of pancreas is about 75 to 100 grams. Look, this is the most important organ for digestion and for glucose metabolism. The pancreas just weighs about 75 to 100 organ, and the length of the pancreas is about 15 to 20 centimeter long. Okay, the fact that the pancreas is situated, so okay, let's just renew that. Okay, so when you ask yourself a question, why is the pancreas has some poorly localized pain when we have pancreatitis, for example, or malignancy of the pancreas? Why the manifestations of pancreatic pathology is ill-defined, as called? Okay, this is due to the fact that the pancreas is deeply located organ. Okay, so as you can see here is the abdomen. Pancreas is very deep, just near to the vertebra. It's a retroperitoneal organ. This explains why the pancreas is has ill-defined symptoms. Okay, or the patient may have a tumor of pancreas with just ill-defined discomfort of the abdomen for months, unless he has some kind of bile duct obstruction. Okay, so this is why. And the second important information that we can take from the side of the pancreas, that is a retroperitoneal organ, the pain of pancreas is described usually as a deep penetrating pain that radiate or that goes to the back of the patient. For surgical issues, the surgeons just describe the pancreas as having these regions: the head of the pancreas, and after that the neck of the pancreas, and the body, and least and not last, the tail of the pancreas. Okay, and the head of pancreas can also be further subdivided into the head proper of the pancreas and what we call the uncinate process of the pancreas. Okay, so this is the head, the body, and connecting the head to the body is the tail, is the neck of the pancreas, and at the spleen hilum, okay, we have the tail of the pancreas. The head of the pancreas actually is in the C loop of the duodenum, as you can see, and is posterior to the transverse mesocolon. You know, the mesocolon that links the transverse colon to the posterior abdominal wall. So this is the mesocolon. Okay, and at the end of the mesocolon posteriorly we have the head of the pancreas. Posterior to the head of the pancreas you can see important structures just like the inferior vena cava, the portal vein, for example. You can see them all posterior to the head of the pancreas. So this is the head. Here we can see the portal vein, the inferior vena cava, and of course also we can see the renal arteries, the right renal artery and the both of renal veins. As you can see, the kidneys are part of the scene. Okay, so behind the head of the pancreas we can see the right renal artery, but both the right and the left renal veins. The neck of the pancreas lies directly anterior to the portal vein. Okay, so anterior to the portal vein directly we have the neck of the pancreas. Okay, the posterior relationship of the head of the pancreas are the inferior vena cava, the right renal vein, artery and vein, and the left renal vein only. Okay, and the head of the pancreas, as I told you, is posterior to the transverse mesocolon. Okay, and at the inferior border of the neck of the pancreas, so this is the neck of the pancreas, at the inferior border you can see the superior mesenteric vein joins the splenic vein to form the portal vein. Okay, so posterior to the neck of the pancreas you can see the portal vein. Okay, and the portal vein is the result of the joining of the superior mesenteric vein with the splenic vein at the inferior edge of the posterior part of the neck of the pancreas. In most cases the so the portal vein is the result of the splenic vein, superior mesenteric vein, as I told you, and also the inferior mesenteric vein is one of the contributories to the formation of the portal vein. Okay, so the inferior mesenteric vein joins this blood vessels in one of three ways. In most of cases the inferior mesenteric vein joins the splenic vein. Okay, and the splenic vein joins the superior mesenteric vein, as I told you, at the inferior side of the neck of the pancreas to form the portal vein. But the inferior mesenteric vein sometimes says that I'm not going to join the splenic vein, I don't love the splenic vein. Okay, I want to join the superior mesenteric vein, and this is in some cases. Okay, this will happen. Okay, in some cases also the inferior mesenteric vein will not join the splenic vein, neither the superior mesenteric vein. He's in argument with these two. Okay, so he is going to join the bifurcation of these two. So this is in some cases. Okay, so in some cases, in most of cases, join the splenic vein. The inferior mesenteric vein will join the splenic vein, and the superior mesenteric vein will join the splenic vein to form the portal vein. Okay, in some cases may join the superior mesenteric vein, in some cases may join the bifurcation. We have what we call the superior mesenteric artery, and the superior mesenteric artery is just to the left of the superior mesenteric vein. Okay, so we are building knowledge here. The superior mesenteric artery is just to the left of the superior mesenteric vein. The uncinate process of the head of the pancreas will wrap around the portal vein, okay, in superior mesenteric vein, and it will stop at the space between the superior mesenteric vein and the space and the superior mesenteric artery. Okay, so we have the superior mesenteric artery here, and to the right of it superior mesenteric vein. We have superior mesenteric vein here, and to the left of it we have the superior mesenteric artery. The uncinate process will wrap around the portal vein and stop at the space between the superior mesenteric vein and artery. An important formation to tell that the venous tributaries that drain the head and the neck of the pancreas will usually drain in the right side and the posterior side of the portal vein. So it will come from here and it drain into the right side and the posterior side of the portal vein, but will never drain, or in most of cases it will not drain into the anterior side of the portal vein. So if you put a finger between the neck and the head of the pancreas and the portal vein, you can put a finger, okay, because you have no anterior branches of veins or arteries between the head and the neck of the pancreas and the portal vein. What is the green thing here? It's the bile duct. Okay, the bile duct lies or runs in a deep groove in posterior aspect of the pancreas. Okay, so this is the bile duct and the groove in the posterior aspect of the pancreas. Then it will get into the parenchyma of the pancreas and eventually will join what we call the main pancreatic duct, to drain into the duodenum. The bile that will drain into the duodenum to digest food. About the body and the tail of the pancreas, we have a relation posteriorly with the splenic artery and splenic vein. As we can see here, this is the splenic vein in the posterior groove of the tail and body of the pancreas, and just superior to it we can see here the tortuous, beautiful splenic artery on the posterior superior edge of the body and the tail of the pancreas. Okay, so splenic artery and splenic vein. Many tributaries will drain from the pancreas into the splenic artery and splenic vein. Okay, the pancreas is just posterior to the stomach, as we all know. So what may happen as a result of what we call the pseudocyst of the pancreas, which is a collection of enzymes due to the happening of a pancreatitis, the pseudocyst may drain into the stomach. Okay, it may invade the stomach and drain into the stomach. Okay, and at the inferior edge of the pancreas, this is the lateral view. Okay, so this is the pancreas, this is the pseudocyst of the pancreas, collection of enzymes that invades the stomach, okay, and drains in it. Okay, so at the inferior edge of the pancreas, actually we can see the transverse mesocolon. So this is the mesocolon, this is transverse colon, this is transverse mesocolon. We can see it on the inferior edge of the pancreas. The last thing I want to tell you about the gross anatomy of the pancreas, that the neck of the pancreas is just anterior to the vertebral body of L1 and L2. Okay, so the neck of the pancreas just anterior to the vertebral body of the L1 and the L2. As I told you, it's very deep organs, retroperitoneal organ. So this is the pancreas. Okay, the neck of it is just anterior to the L1 and L2, and that means that any trauma to the pancreas may lead to a serious compression of the neck of the pancreas against the L1 and L2 of spine, causing parenchymal and sometimes ductal injury. Okay, so this is an important information to end up the gross anatomy of the pancreas with. Okay, so in the next video I'm going to complete about the pancreas. I'm going to talk about the pancreatic duct anatomy. Okay, thank you very much for watching this video. See you in the next video.